to ATI. Today's topic is erythromycin. Erythromycin is taken orally or through an IV. The usual dosage range is from 250 to 500 milligram every 6 hours. For severe infections, you can take up to 4 grams per day.
There you go. Erythromycin is used for the treatment and prophylaxis of bacterial infections. It is mainly used in patients who have allergies to penicillin or have penicillin-resistant infections. Susceptible bacteria include staph, strep, gonorrhea, Haemophilus influenza, and is the drug of choice for Bordella pertussis, or whooping cough, Legionella pneumophila, or Legionnaire's disease, and Mycoplasma pneumoniae and diphtheria. Erythromycin inhibits protein synthesis by binding to the 50S subunit in the bacterial ribosome. The effects are mainly bacteriostatic, but at high doses may be bactericidal.
The adverse effects are nausea, vomiting, abdominal cramping, pain and swelling at the IV site, hearing loss, dizziness, and irregular heart rhythms. Signs of overdose include hearing loss, dizziness, and heart dysrhythmias. There are no specific treatments for overdose.
Before you begin taking this drug, let your doctor know if you have liver disease, heart dysrhythmias, myasthenia gravis, or electrolyte imbalances. Take oral erythromycin on an empty stomach 1 hour before or 3 hours after meals, unless it is enteric-coated. Increase your daily fluid intake to 2 to 3 liters. Do not stop taking this medication unless directed by your doctor. If you do miss a dose, take as soon as you remember. If it is close to the time of your next dose, skip the last dose and continue taking medication as prescribed. Do not take erythromycin with fruit juice. Do not crush or chew tablets. They must be swallowed whole. Nausea, vomiting, cramping, diarrhea, heartburn may occur with the use of erythromycin. Notify your healthcare provider if these symptoms do not go away with use. Monitor for signs and symptoms of infection, which may occur while on this drug. It is important to follow up with liver function tests while taking erythromycin, as liver toxicity may occur. Signs and symptoms of liver toxicity include abdominal pain, nausea, vomiting, fever, jaundice, or yellowing of the skin. These might be seen after 1 to 2 weeks of therapy. If you have a fever above 100 degrees Fahrenheit that lasts for more than 3 days, let your doctor know. If you are taking more than 4 grams of erythromycin each day, monitor for and notify your healthcare provider if you experience dizziness, nausea, or changes in hearing. Notify your healthcare provider if you experience severe diarrhea and fever. This could indicate a superinfection. Let your healthcare provider know if you become pregnant or are thinking about becoming pregnant. Breastfeeding is not recommended while taking this drug. Do not take erythromycin if you know you are sensitive to erythromycins or other macrolide antibiotics, or if you have electrolyte imbalances. If you have a history of hepatotoxicity and hepatic disease, use extreme caution while taking this drug. If you have a seizure disorder, GI disorder, or are pregnant, it may not be safe to take erythromycin. Let your doctor know of these circumstances before beginning drug.
This has been an erythromycin update from ATI.
Make sure you take up to 4 milligrams per day. 4 grams per day. We might have to cut.
Pertussis, or whooping cough, Legionella pneumophila. Cut.
Skip the last dose and continue the taking.
Treatments for overdose.
You were fabulous.